76% of unsheltered people currently experiencing homelessness in Los Angeles are affected by mental illness, substance abuse, physical disabilities, or poor health. So the question is, what can we do to help? My name is Natalia Okamura, and today I will be providing you with some information and some updates on the Helping Hands program, a Healthcare for the Homeless initiative. Before we get started, I would like to say thank you to everyone here for your generous donations to the project. Over the past 3 years, I have been in charge of similar projects that have been built to help and serve homeless communities across the country. In this briefing, I will give you some information about the Helping Hands project, a slight bump in the road we've encountered, and our action plan. I'll give a summary at the end and give you the opportunity to ask some questions. So let's get started with some basic information about the Helping Hands program. Our main goal with Helping Hands is to provide free and, most importantly, accessible healthcare to those currently experiencing homelessness across Los Angeles. This is a very important and a very necessary project, especially with the increase in COVID-19 cases across Los Angeles. And fortunately, this project has been made possible by the generous donations of various companies and organizations across Los Angeles. Thanks to the donations, we will be able to establish over 300 healthcare units across LA. However, we did encounter a slight bump in the road when creating projects that cater towards the homeless communities. Efficiently communicating our message to them is always a bit tricky. Many of those experiencing homelessness do not readily have access to the internet, so obtaining our information could be difficult. As a result, I have decided to postpone the construction of a small portion of our clinics that were originally to be built. Though this is a problem we have encountered, it's not a reason to worry. I have already drawn up an action plan and have taken all necessary steps to minimize any financial loss for this project. The first thing I have done is I have canceled the construction of 100 clinics out of the 300, and I am reallocating those funds to create 200 mobile clinics. So we will have a starting total of 400 healthcare units available, 200 clinics, and 200 mobile clinics. Second, I have formed a team of volunteers that will be giving presentations on our project to shelters and food banks across Los Angeles, so they will have our information ready to give out. So I'm going to start wrapping this up and hand it over to you for some questions. I have provided some information about the Helping Hands program, the slight issue we've encountered, and the action plan to fix the issue at hand. To summarize everything, our mission at Helping Hands is to provide free and accessible healthcare to those currently experiencing homelessness in Los Angeles. However, we did find a slight problem when it comes to communicating our message, but with some reallocation of our funds, we were able to establish a new system of mobile healthcare clinics that will be able to travel directly to highly populated areas. Volunteer members and staff members at food banks and shelters have been made aware of our program, and I'm very excited and happy to say that together we will be saving many lives. Thank you very much for your time.